Good afternoon, everyone. Let me have my welcome to everyone. I'm delighted that you're here. For those of you who don't know me, my name is Tom Diano. I'm a fortunate person to be the program director. I'm walking in the shoes of John Billings, and you know how great he is because you saw his wax talk. And I am an organizational psychologist by training, so I'm focused a lot on the people side of management. And let's see, what else can I tell you about myself? I have been teaching healthcare management for 35 years. This is the part where you're supposed to say you started when you were 10. This is year 35. I have taught in such places as Michigan, the University of Chicago, Columbia University. But of all the places I have worked, and I happen to like it here the best, for lots of reasons which we can talk about. I'd like to spend just a few minutes giving a very brief overview of our program and then opening up for questions. And hopefully you'll have lots of good questions. We had good questions at our table here. And we'll try to get some discussion going and then actually hopefully also have time for you to take a break and stretch a bit before the next event. So across New York City, across New York State, and across the United States, and for that matter, across the globe every day, there are millions of people who cannot get access to health care that they need. There are millions who pay too much. All of us maybe pay too much for what we're getting. And even when we get in the door and pay too much, the quality is not what it should be. It is the mission of this program to put tools in your hands to make a difference as policy analysts, policy advocates, and managers and leaders of systems here and around the world to make a difference on cost, quality, and access of healthcare. That's what we aim to do. I think we do a great job at it, and we would like to have you join us in that mission. So here's how we do it. I'm going to show you just a couple slides. Here's the mission, putting a little bit more formal words on nice purple. Hopefully shows up okay. We start off with a core set of courses, and I just want to spend a bit on these and actually differentiate from the Master of Health Administration program or MBA or other programs that you might be interested in, including MPH, Master of Public Health. What you see here, I think, is an outstanding set of core courses that helps you get ready to be manager and policy analyst in healthcare, and then for that matter, in any field that you want to go into. So there's microeconomics, understanding economic tools and principles. There's managing public service organizations. This is actually a course that's near and dear to my heart because I'm an organizational psychologist. I have taught this course or similar courses like it for those many years that I mentioned. And this is about leading people, teams, organizational change, understanding the role of organizational mission and values and culture in organizational performance. Then there's introductory course in financial management, introduction to public policy, how is policy made, right? Key issues there. How does policy affect so many different sectors of our lives? And then we have statistical methods, which we're fortunate enough to have Jan as an outstanding teacher of stat. And so, in my mind, these courses provide a very strong foundation for whether or not you're going into management or policy. Why? Because we believe in cross-training. We believe that managers should understand the policy context in which they're working. We believe that policy folks need the same sorts of people skills that you see here from this course. And of course, policy folks need to know economic analyses and statistical analyses too, as do managers. Healthcare managers need to be able to answer a question. How do I know if a program is working? What kind of data can I get on it? And what difference does it make? So very quickly, in contrast to, let's say, a Master of Health Administration, in Master of Health Administration, you'll get all these courses. The only real difference actually is that these courses provide examples from many different kinds of sectors, important sectors, and the Master of Health Administration will provide those limited to healthcare. But otherwise, the skills that you're learning, the concept, the skills, the tools to make a difference, they're the same. We have here at Wagner, and I think this is one of our strengths, we have a number of different specializations. course, we have health services management, but in the policy side, we have analysis. So people who are really dedicating their careers to understanding the impact of policy. What difference do they make? Who do they affect and how? As well as understanding on the analytic side of it, what about policy options? Should we choose policy A over policy B? What difference will it make? We also have an advocacy track. This is for folks who want to develop skills in saying, okay, I think I know what policies work. There's some evidence base out there, as John was describing earlier this morning. Let's try to advocate and make governments and make communities use the policies that we know work and not use the ones that don't work. We teach advocacy skills there. And of course, here we have health finance, health services, financial management. There's an interesting twist on this. This is mainly focused on the finances of providers of healthcare. So places like NYU Langone that you heard from. But this is actually more on the public financing side. So we actually have some folks here who work for New York City Hospital and Health Corporation. They have a very large, of course, right, the public financing role there because they're mainly financed with public dollars, whether they're state, local, or federal. We also have an international health specialization. And finally, as John liked to say when he was running the program, if you can't figure out any one of these, we can also customize a specialization for you. I kind of discourage that, but anyway, you can do that. Questions on these? I'll show you what's, maybe when I'll show you two more slides, and then we can open up for questions. But I'll show you what's involved. Here, you can see the health services management specialization. I took this as a basic set of courses for you to see. You can see here there's an introduction to health policy and management. This is a course I teach. This is about leadership, managing people, teams, organizational change. This is there's also strategy involved here, continuous quality improvement, information technology, health economics, human resources, and more finance and accounting. So basically what you can see here, I think, a very well-rounded curriculum that gives you the skills and knowledge that you need to actually be a successful manager in lots of different parts of healthcare. So a lot of times I tend to think of managers in the big healthcare provider systems. But it turns out that we have graduates who work in insurance companies. They use these same tools. We have graduates who work in smaller federally qualified health centers, so smaller clinics. They use these same kind of tools. So I think that these tools and this knowledge are very portable in any type of broadly defined challenges for healthcare management. You can see here that a lot of these courses are actually similar to courses that you would have if you were in an MBA program or certainly in an MHA. This is actually not an entirely up-to-date list. It leaves out some important ones, but you can see that there's some here. One of the things that I'm actually proud of our students, in addition to all of this great list here, is that they're in the last 3 years we've had 3 students go to McKinsey Consulting, which is oftentimes considered, no offense, well, you know about McKinsey. Anyway, we have 3 students go there in the last 3 years. And you can see there's other variety of places that they go. On the health policy specialization, these are the required courses. These courses are also quite important. This one in particular, goes to these evaluation skills that I was mentioning a minute ago. Sherry, our dean, teaches health economics principles. And then let me round that out a little bit. You can see for the analytics track, Jan, you're teaching estimating impacts, don't you? Yes. This, in my mind, is an incredibly strong set of courses for developing your skills to actually analyze the effects of policies and policy options. Really strong faculty, really strong set of skills. Down here, same can be said for the advocacy track. You can see that we have here electives, and there's some electives down here for the advocacy track as well. I thought I had a slide about there. I guess not. Okay, I'm sorry. I thought I had a slide about the jobs for policy folks, but in fact, they also have a great set of jobs that they have taken over the years. So let me stop there and see if you have questions.